Good morning. I'm Dr. Ericka Mizuta, and I'm one of the owners of Recover Healthcare. I wanted to do a video this morning because I wanted to talk to you about something that I'm doing in my personal life that also greatly affects the patients that I see in my physical therapy practice. And it's something that a lot of people don't tend to think about unless they've actually been diagnosed with the actual healthcare problem. So I listen to a lot of podcasts. I do a lot of continuing education. And one of the podcasts I love to follow is Lewis Howes' School of Greatness. He has a lot of great medical professionals on there. And I listened to a podcast the other day where he had a woman who is a physician, and her name is Dr. Casey Means. And she used to be a surgeon, but she recently has changed into the metabolic health practice and has a new business that's called Levels. And that's what I wanted to tell you about, because this is something that I'm actually going to be doing for myself for the next 60 to 90 days. And I think it's valuable information. So when you talk about metabolic health, what we're actually talking about is how your body processes the food you eat and if your blood sugar is high or not. So I see, just by default, a lot of complex patients, and I do have a lot of patients that are type 2 diabetics. Now, type 2 diabetes is an interesting thing because some people would think, how does that affect physical therapy? Well, some of these people have had amputations because they have had wounds that haven't healed because of diabetes. The diabetes destroys their vessels, and so they've had foot, ankle amputations, they've had below the knee amputations, lots of different things. Diabetes also affects healing rate too when you're a post-op patient. If you do have diabetes, you really need to watch and eat proper amount of protein, not have high blood sugar. I'll see patients who have, surgical wounds that don't heal, and that's related to the diabetes. Now, some of the other things that people don't think about, so many people in the United States have autoimmune disorders, which are chronic inflammation disorders. And there is more and more evidence now that is linking that to diabetics. And it's not just people that are diabetic, it's people that actually have a fasting blood sugar level that's slightly higher than normal, but not maybe enough to be diagnosed as a diabetic. And so this is one of the things that Dr. Means was talking about, is that there's new research coming out, because right now the gold standard is that if you take your blood sugar, if you're fasting, and it's below 100, that is somewhat considered a normal blood sugar level. But with all the new research that's coming out, we're finding that that's actually not normal. That a more normal blood sugar reading, and she said this from her research, was between 70 and 85, which is actually quite low. And I've always been a person, mainly because type 2 diabetes does run in my family. My grandfather was a type 2 diabetic, and my dad for a period of time was diagnosed type 2 diabetic. Now my dad was able to, he took metformin for a while, and he actually he redid his diet, he lost some weight, and his A1C, which is a measure of your blood sugar levels over a period of time, actually went back to the normal range, and so he was no longer diagnosed as a type 2 diabetic. But this is something that constantly needs to be monitored, and because I have a family history of it, I've always been interested, and I always have checked my blood sugar levels even though I'm not diagnosed as a diabetic, because I want to make sure. It's kind of like weighing yourself and making sure that you're staying within the normal ranges. So I use it's a OneTouch. It's a Vario Reflect, and I got it off Amazon. It was about $30, and I use that a few times a week to test my blood sugar. Now, the thing that's interesting to me, and that's hard to do with that type of monitor, because I have to finger prick with a needle, which I'll do it in a minute, is that you have to continuously do that to get a readout. And there's so many things that actually affect your blood sugar. And it could be that I would check my blood sugar on a morning where maybe I slept 8 hours the night before, and I didn't have any stress from work or my kids, and maybe I hadn't worked out, and I'll get a reading that's 80, 85, and I think, oh, I'm doing great. But the thing that we have found, and Dr. Means has found this through her research, is that there's so many things that affect your blood sugar. Like I just said, if you're not sleeping well, if you're stressed, it could be if you're dehydrated. There's a lot of things. So I've tested some mornings where I've had those different factors going on, and my blood sugar was high. It was like in the 122 range, which is actually a diabetic, pre-diabetic range, and that's not healthy. So with her new company that I'm going to be doing, it's a continuous glucose monitor. And so what that means is that I'm actually going to be, I'll show you, I ordered my kit. So the kit came, and again, the company is Levels. So I have a QR code here to set up everything, and it's going to be set up through my iPhone. And what I'm actually going to be doing instead of finger pricking is that I am going to be using, this is called a Dexcom. And so this is a device that actually on my arm is going to insert a continuous glucose monitor. Here's all my pieces. And the way that works is that it's kind of like a little gun device. It shoots the little monitor into your arm, so you're going to keep that in for 30 days. And it actually has a wire, a small tiny wire. It kind of looks like a thread. It's very thin, and that goes into your skin, and that's going to give you a continuous readout. So when I hook it up to my iPhone, at any point I can actually go look and I can see what my blood sugar levels are. And so one of the things that's interesting too to know about blood sugar levels, and I, like I said, I have a lot of patients that struggle with this, and I do have patients that have continuous monitors, is that exercise will affect your blood sugar, and it affects people differently. So for example, I know that when I do cardio, my blood sugar level will raise slightly. It doesn't go up that high, but if I do a heavy weight training workout, it's actually going to raise that blood sugar level higher, because you're basically sending sugar to the muscles to help with that muscle contraction. So what I'm interested in is I want to know, once I do raise that level with my weightlifting workouts, how long is it staying high like that? And also, are there ways that I can clear that excess sugar out faster? And there are, and this is what that company is going to help me figure out. So, it's going to be, what am I going to eat after I work out? I might not necessarily want to eat carbs if my blood sugar level is too high. I may need to eat more proteins. And all of these things are individualized per person. And so blood sugar levels and diabetes is not something where you can just give a recipe to a patient and say, here, it's a one size fits all. It's completely different. And I have a patient right now, it's very interesting. He's type 2 diabetic. He has a glucose monitor, and he's been just playing around, experimenting with different types of food that he can eat. And certain types of bread that you would think would be great for a diabetic, when he eats it, it spikes his blood sugar. And other types that are probably not so great when you look at the nutrition information, he's fine with. And it just depends on how his body is processing it. So that's valuable information for him to know, because he had spine surgery. The higher and more uncontrolled his blood sugar is, the more inflammation that he has, and he has a lot of nerve, it's called radicular pain, where he had compression of his spinal cord before the surgery, which led to the actual surgery. And so when his blood sugar levels are high, he has a lot of numbness and he has a lot of weakness in his legs. But when the levels are lower, he doesn't necessarily have that. So we're using his blood sugar levels to also help with his recovery, and to also, any exercise they give him. The more things I give him, if his blood sugar is uncontrolled, the exercises can cause inflammation, the blood sugar causes inflammation, and he has more pain. So we're actually trying to use this together so that he's not taking pain meds, one, as much, but two, he's getting his blood sugar levels under control. Now, the other reason why this is important is because there's a new type of diabetes that not a lot of people know about, and it's called type 3 diabetes. Type 3 diabetes is going to be typically people that are type 1 or type 2 diabetics end up turning into type 3 diabetic. And basically what that is that we now are seeing that Alzheimer's and dementia and different brain issues are caused by uncontrolled high blood sugar levels. So if we know that having high blood sugar levels is a cause for Alzheimer's, it's something that can be corrected. Even if you have a genetic predisposition to having Alzheimer's, you can actually correct one of the components, which is the high blood sugar, and maybe you won't actually get Alzheimer's. So this is a lot of the new research that's going on. So I'm going to be doing at least a 60-day program here with levels, where I will be experimenting with the foods I'm eating, tracking my blood sugar level, letting you guys know what it is. And you can see if you might want to do this for yourself, but it's something that I highly recommend, because this is actually one of the keys to metabolism. If anybody is overweight, struggling losing weight, this could be the reason why, is because your blood sugar levels are too high, you don't know it, and it's actually preventing you from having proper metabolic health. So I would recommend definitely checking out that podcast. We'll link it, Dr. Casey Means. In that podcast, she talks about life hacks for metabolism, how you can use your mind to control your metabolism, also food, exercise, and basically what is a great definition of health. But I mean, we're in a health crisis in the United States. We have almost 70% of our population is either obese or overweight. And when you are one of the two, you are definitely going to have some issues related to some metabolic health. And like I said, it could be that if you take your blood sugar levels right now it's below 100, you know, it might be high 90s, and you know, you're being told that that is okay. But more research is showing that that is actually not okay, that those levels are still high. So in the next few years, we're probably going to see a revamp of what the actual normal numbers are for blood sugar levels. They're going to come down. And like Dr. Mead said, it's probably going to be between 70 and 85. And that's my target goal. I know I'm not in that range. I'm definitely less than 100. I'm usually more in the 90s. And I was actually going to do it here live just so you could see what I am. Sorry, I'm actually using my, I'm going to do a finger prick here. So I'm looking down. Now, keep in mind, so it is 9:30 in the morning on a Friday. I ate dinner last night at 5 o'clock, and I had a salad that had chicken on it. I haven't had anything to eat this morning. I drank a little bit of coffee, but I'm still fasting. But I did do a workout this morning. So I didn't do weightlifting, weight training. I did more cardio, but that actually is probably going to raise my blood sugar level a little bit. So I want to show you, because I look like a healthy person, that it actually might be a little bit high. So my guess is that my blood sugar right now is between 90 and 110. Let's just see. So I pricked my finger. So this is what I wanted to show you guys. And again, working out does increase it, but I'm at 103 right now. So to not be considered, you know, in that pre-diabetes range, I need to be less than 100. Now, my workout did raise that. I should have actually taken my blood sugar levels before the workout, because then I could have showed you that. But I will be able to show you that with the continuous glucose monitor, how everything is affected. And then what I'll be able to show you is if I do have a level that's too high, I'm going to use different strategies. So sometimes it's going to be drinking water and waiting like 30 minutes. Sometimes it might be literally, you can do meditation. She's found that helps, and reduce it. It might be eating something specific to bring it down. So these are the experiments that I'm going to do over the next 60 days, and I'll show you guys my results and help you understand how you can unlock your metabolism and actually really become healthy and get out of this. You know, we have to get these people that are obese and overweight. It's not healthy. We have to stop this in the United States. It's a healthcare crisis. This is one of the big things we need to be talking about. And actually, we know now too that one of the leading causes of death from COVID is people that have excess body fat. There's a great study, which I can also link, came out of Stanford University. We call it the Stanford Fat Study. But essentially what they found in that study, and there's different types of body fat, is that COVID feeds off body fat. And if you have too much body fat and you get COVID, it's essentially a buffet for COVID. And it's like compounding interest in your body. And this is why those people had multi-system organ failure. This is why these people died. A lot of people died of COVID. So if you can unlock your metabolism, get into a healthy range, there are going to be so many diseases that you're not going to be at risk of dying for. And COVID is one of those. You know, again, cancers. We all know that sugar is a food for cancer. And that's why when you have, you know, you're having a PET scan done for cancer, it's basically sugar, and the cancer uptakes the sugar and then it lights up on the scan. So there are a lot of things that could be prevented from having proper blood sugar levels and understanding your metabolism. So that's my service announcement for the day. I will let you know how everything goes, and we'll link everything here. So again, I'm Dr. Ericka Mizuta of Recover. Like our videos, subscribe, follow us on YouTube. We're also on Twitter, we're on Instagram, we're on Facebook. But we want to help you be healthier and show you some of these simple hacks that you could do even on your own without doctor's prescription. You can figure out your health, but definitely you should do it with your doctor too. Thank you.